Our CRMA report can also help you make a better determination of who you want to send out for an MRI. So you're using sound clinical rationale, and not just because somebody in the market may want you to do the MRI. You want to have very sound clinical rationale for exactly what you're doing. Take a look.
Now, this is called the predictability of severity of disc degeneration and disc protrusion using horizontal displacement of cervical dynamic radiographs. So what this says is this. So if you have a CRMA report, you can go down and look at the graphs. The graphs may look a little bit different, but you have this back and forth motion. So if you have back and forth motion and you have actual motion in extension, so you look at the chart and you say, okay, in extension, then if you have actual C5 or C6 extension, C5 on C6, so it's always measured, translation is always measured the top vertebra on the bottom, on the vertebra below it. So in these results, it showed that if you had extension abnormalities, 93% of the time, it was 93% sensitive for disc protrusion. Now, if you had it at C4 and C5, so C4 and C5, so if these two vertebrae right here in extension are actually showing, remember, the excessive motion is telling you about the ligaments around the disc, but it's very difficult to just damage the ligaments around the disc without damaging the disc. So you could have, although it does happen, and it does happen more frequently than what you think, you can have severe damage without damage to the disc, severe damage to the non-disc ligaments. But if I have any damage in there to the non-disc ligaments, I have rationale for making an MRI referral. So I'm just going to document in my notes that I have significant damage, so in this case severe damage, grade 3 damage. I have severe damage to the support ligaments. I'm referring out to the MRI in order to see if there's disc involvement. And that's how simple this is, but now you're actually making the referral off of your earlier ligament study on the x-ray itself. Thank you.